Hi everyone. Today we are going to talk about heart attack. What is heart attack? Heart attack is substernal or left-sided chest pain, radiating to left arm, neck, jaw, stomach, associated with breathlessness, nausea, vomiting, or sweating, and lasting for greater than 30 minutes. So why does heart attack occurs? Heart attack usually occurs because of the obstruction in the passage of oxygenated blood to the part of the heart. Now, why does this obstruction happens? Now, this obstruction may happen because of plaque rupture uh, in the coronaries, or it may be caused by the platelet plug, which obstructs the flow of the oxygenated blood to the corresponding part of the heart, thus causing ischemic pain, or we can say ischemia is lack of oxygen, and so this lack of oxygen to the part of the heart causes this chest pain. What are the causes of this heart attack? So the causes of heart attack are many, but to enumerate are a few of them are it may be high cholesterol content in the blood, which accumulates in the lumen of the coronaries of the heart, and thus thereby decreasing the lumen diameter. So the passage to the part of the heart or the corresponding part may be decreased. Second may be smoking, which also has some effects similar to this. Then high blood pressure may cause plaque rupture as the speed or the velocity of the blood in the coronaries increase. It may rupture. It may cause plaque rupture, and certain stress is also like one of them. Lifestyle modifications like uh, eating habits, eating junk food, eating oily food, uh, all these sedentary lifestyle, all these are factors which may be a leading cause or prominent cause leading to heart attack. Then age factors are also there. Usually males past 40 years and females past 45 years are predisposed to heart attacks, and gender preponderance is also here. Gender preponderance, males have more propensity of heart attacks as compared to females. So, what are the some of the preventive measures that can be taken to decrease the risk of heart attacks, though not if not fully, but to larger extent? Some lifestyle modifications like adequate exercise. In adequate exercise, one can walk. Adequate walking or exercise at least for a period of 30 minutes. Brisk walking for a period of 30 minutes may be very beneficial to the health of your heart. Then avoiding junk food, eating green leafy vegetables, fruits. These are some of the healthy lifestyles which you can adopt in your everyday life, in everyday routine life. Then avoiding smoking, excessive alcohol abuse, avoiding stress, which is like too much in today's world. Taking less of stress. All these are some of the factors which can be taken care of. Now, here one you will be surprised to know that alcohol in moderation, like if you say 30 ml pint in moderation, even if you take every day, that may be good for the health of your heart, as it increases the level of HDL, which is high density lipoprotein. In layman language, you can call it good fat, or and it also decreases the level of LDL, that is low density lipoprotein. In layman language, it's called as bad fat, which has a tendency to accumulate in the coronaries of the heart. So alcohol, but if taken excessively, may damage your liver also. So kindly do take care of that. And alcohol only in moderation may be helpful for the health of your heart. uh, Coming to the just in case there's an episode of heart attack, what things have to be taken care of? Immediately rush to your doctor. And there are two parts of the treatment. One is the medical treatment, and the second is the surgical modality. As far as medical treatment is concerned, the drugs which are given usually by a doctor in an episode of heart attack are blood thinners like ecospirine, clopidogrel may be given. Then anticoagulants like heparin may be given just to decrease the viscosity of the heart, to facilitate the flow of the decrease the viscosity of the blood of the the viscosity of the blood and to facilitate the blood flow to the through the coronaries to the part of the heart. Then oxygen may be given from outside, as the patient has breathlessness and he usually has air hunger. So oxygen is usually given via mask from outside. Nitrates are drugs which dilates the lumen of the coronaries of the heart, thus facilitating blood to the corresponding part of the heart. And then just to decrease the ischemic pain, this is ischemia is lack of oxygen. So just to decrease the ischemic pain, myocardial infarction or heart attack is basically ischemic pain that happens because of lack of oxygen. So and nitrates dilates the lumen of the coronaries of the heart. Uh, dilates the lumen of the heart, coronaries of the heart. So these are some of the modalities which can be taken, medical modalities which are usually practiced as far as treatment of heart attack is concerned. Then coming to the surgical modality, angioplasty is inserting stents and balloon dilatations of the coronaries of the heart may be done, which facilitates the flow to the part of the heart. For this, angiographies are usually done, which assesses the stenosis or the luminal narrowing of the coronaries, and then if the luminal narrowing or stenosis is more than 60 to 70%, your doctor may advise you for the insertion of stents. So, and just in case if there is an episode, so it becomes necessarily important to get stents inserted. So now for today, I think this information will be useful for you. I'll see you in the next video. Thank you.